All right. Good afternoon, everyone. Thank you for joining us today. As I mentioned a moment ago, we do have a really small group for this session today, and that is no surprise to us at all. I know it's not like a burning priority right now to understand what CPCA is doing with connected communities. However, it is very important to be knowledgeable about the different resources that CPCA is offering. So I'm going to just do a couple of quick introductions before we really jump right into the demonstration. So briefly, my name is Tiffany. I am the Associate Director of E-Learning here at CPCA. This is the first of our new webinar feature, which is our Lunch and Learn session highlighting different CPCA member benefits. I will apologize if I look away from my monitor. I'm not being distracted. I actually have notes in front of me and I really want to stay on topic. So anyway, so we recognize in the new abnormal that we live in, there's a lot of new technologies. And I know folks are saying they are Zoom fatigued, but I think we're all honestly just technology fatigued in all devices in any kind of a virtual environment, and the mobile apps and all the different web accounts and passwords we have to remember and things like that. So it's just another account, another password, another thing to learn and adopt whenever we come out with new technologies. And I totally validate your feelings of just kind of being, you know, a little worn out with all of it right now. But we also know just how much value it does bring to us when we need it. So we wouldn't be offering this to our members if we didn't think it was going to be of value to you. And so we want to thank you for joining today and learning about our peer sharing platform. It's our hope to be bringing more of these type of Lunch and Learn webinars to you in the future. And so we will definitely put out more communications as we outline that content. So as Associate Director of E-Learning, I've been with CPCA here for 8 years now, and I run all things related to our webinar and web-based learning. I also handle all of our video project work, and let's see here, what else? Oh, and I'm co-leading the new online learning portal where our annual conference and our finance conference was hosted this year. So that's a little bit about me at CPCA. This is on your screen, a little bit about me outside of work. I am a mother to 4 amazing kids, ages 20 to 9, and they are all at home, as well as my husband working from home. So you might see some faces coming on down these stairs or something. Don't mind them at all. I made sure they all have their pants on. So let's see here, just really quickly, we're all pretty much aware of how Zoom works. Please know your lines are open, but they are currently muted, but you do have the power to unmute your own line when you want to speak. So please, you know, definitely be mindful of that. And you are also able to chat with the audience or any of us that are on this session by opening that chat bubble here, and you can have conversations, and I'll try to remember to monitor that. So really quickly, I really like this quote: when the why is clear, the how is easy. And so I just wanted to briefly explain why we decided to launch Connected Communities. As you may be aware, we do facilitate peer networks for our members, which provide networking and educational opportunities for health center professionals. And they provide an opportunity to exchange information, share best practices, templates, tools, resources, and we provide feedback into state association activities, policies, and training programs. We now support 16 different peer networks, which host over 2,600 active member health center staff on a regular basis. And we support these through email, communications, conference calls, and meetings, sometimes in person, when COVID is not impacting. But as our peer network communities continue to grow in size, the breadth and complexity of the topics have also grown. And so for the past couple of years, CPCA staff have recognized the need for more real-time access to your knowledgeable peers for information updates, as well as a way to communicate and share information and resources. So Connected Communities has made that possible for us to create this opportunity, and it's growing further than just peer networks. We have 33 active communities for a whole range of issues right now. And our newest communities are open to all members, and I'll highlight this in an email after our session today. But the newest communities are highlighting our restoring patient services, as well as a licensing and OSHPD-free community. So with that, I actually want to introduce my colleague to you, Peter Dye. He's Senior Program Coordinator with the Care Transformation Department. Peter?
Thank you, Tiffany, and good afternoon, everyone. As Tiffany stated, I'm Peter Dye, and I'm the Senior Program Coordinator with our Care Transformation team. But also, why I'm here today is to talk about one of the benefits that my community saw, because I am the community moderator for the Behavioral Health Care Network. And in case you haven't met me before, if anyone at your health center has any questions about, the behavioral health provisions in the FQHC space, I'm usually the go-to here. So feel free to reach out. Next slide, please. So before Connected Communities, for about 3 years, the Behavioral Health Care Network facilitated peer-to-peer learning. We have a lot of health centers here in California, and it's kind of hard to connect with one another, especially those that are in your regions. We understand that things may be proprietary or sensitive at times. So we were asked to facilitate a peer-to-peer learning, which was quite a process for both CPCA staff and our members. So the process went, if you had a question that you wanted to ask, we asked questions to the Behavioral Health Care Network on a monthly basis. You would have to wait a month to receive responses from your peers. And how we did it in the past was you had to submit your answers on a Google form. And then after that, it would take staff a couple business days, and we'll send out a summary of responses from the Behavioral Health Care Network. So while this was effective, before we had our Connected Community, there was that lag time in asking your question and receiving a response. Thank you. And now that we have Connected Community, we at CPCA don't have to facilitate that process anymore, and community health centers that are members could directly ask questions in our Connected Community. And I really saw a benefit in this, especially with our Behavioral Health Care Network. So I want to highlight, I know the image may be small, but on the left-hand side, you could see that all the questions that were asked in the past few months were actually responded by another community health center and not a CPCA staff member. And I think that's the real value of having this. And especially with the discussion thread that I'm highlighting in this slide with the behavioral health model, someone wanted to know about how different health centers were scheduling at this time. And, you wouldn't want to wait a week to get those kind of responses. So fortunately, there were multiple responses from different health centers to help this behavioral health director learn from others and kind of see what others were doing in the industry and how it could work for them in their practice. So I really wanted to highlight that because it's a great thing not to wait for the summary results from our peer-to-peer learning, and just to know that you could have a question through the Behavioral Health Care Network. And more commonly, I see that, if there's a question that doesn't really fit into a peer network, you could always shoot it at the all-member Connected Community, and, CPCA staff are monitoring it, but also other health center staff who may not be part of a peer network. So I know Tiffany will be demoing the entire Connected Community, but I definitely want to highlight this portion of it because specifically with the members that I work with closely, we are seeing the benefit of this back and forth questioning and answering in the discussion threads. And that was it for me.
Thank you so much, Peter. I really appreciate you sharing kind of that success stories that we are seeing out of connected communities. It's definitely, I think, taken, we've had over the period of July through September, we had approximately 1,100 individual technical assistance requests, and that we have to report to the state, and that is being collected by our content lead, our program coordinators. They receive those technical assistance requests by multiple different touch points. It can be by phone, by email, through the peer networks, and through connected communities if needed. And so it's definitely, in the times of COVID, our staff are doing the best they can, but sometimes your peers are going to be the most valuable and informed resource for you. So I'm going to go ahead now and just, here's a quick outline of what we plan to cover in our demonstrations. So I'm going to kind of review the the anatomy of the daily digest emails. And then we will demonstrate how you can access the platform from the CPCA website. And then how to search for answers, how to mark a best answer, or how to bump your question if you haven't received a response. And then going into kind of your profile and account settings, and then we're happy to take any Q&A. And please, I know we're a small group today. If you have any questions, again, you can unmute yourself and just jump in. I would really like to answer your question on what we're covering before we jump ahead to the next item. So let me just go ahead. I'm going to switch screen sharing now to my other monitor really quick. So let's see here. All right, Peter, can you let me know, or do you see my Outlook?
We see your Outlook.
Okay, perfect. Okay, so don't worry, we're in my Connected Communities folder here. You can't see any other work-related emails in here at all. So I'm going to go ahead. So the Daily Digest email is the default that all members are receiving for notifications each day for any activity that's going on in the conversation or the discussion boards. So what you'll find, really quickly, let me go back. You'll see I've got multiple of these emails. So I will say the one kind of downside is the fact that if you are involved in more than one community, you will receive an individual daily digest for each community that you are involved in. However, if there's no activity that's happened in the past 24 hours, you won't receive an email at all. So you're only receiving these daily digest emails when there's actually activity occurring in the discussion boards. So I'm going to go ahead and open one of these daily digest emails. This is from our all member community, which is the largest community that we are hosting. We do have pretty close to 9,000 health center staff members from California that are in this community. Obviously, a very small handful of them are actually engaging and participating in conversations, but we are hoping to see this grow, of course. So what you'll first see is, as you scroll down, this first part is kind of just a quick snapshot of the conversations that took place. So if I were to see here, like, oh, I'm really interested in seeing this conversation thread on the COVID call, right? I don't have to enter the platform in order to read the activity that's going on. If you scroll further down, you will find the information in a much more detailed summary of all the activity that's gone on. So here's that information on that weekly COVID call. We put out an update that, with a new Zoom link to join that call. And if you keep scrolling, you can access all of the different posts and activity that's happened on that conversation thread. If you want to respond to a question that one of your peers has done, you still don't have to enter the platform at all. You can respond by simply, if I want to respond to Shadi here, I could reply to group here on the right side, that blue button, and all it's going to do is open an email. And I can answer and respond to his questions directly from my email. Now, when I send that email, the email that I post is going to immediately display in the community discussion board as well, so that everyone will see your email response. If you don't want folks to see, perhaps you actually want to only reply to Shadi directly and not everyone else. There is this button to reply to sender. Now, if I want to reply to just him privately, when I click this, it will take me into the actual platform. And so I'm going to go into the platform here. And so you'll see this private email that's only going to Shadi, and I can reply here. But I will say, if you reply to someone using Connected Communities, what's going to happen? It's going to go into their Connected Communities inbox. They're not going to receive an actual email from you in their email account. But there is a way that you can do that. So if you wanted to reply to Shadi, but maybe you don't know Shadi's email directly, you can go into, let me take you back here, the directory. And if you scroll down, we can search for Shadi. We'll find him here. And then we can go ahead and just click his email and send him an email directly from our actual email account. So there's multiple different ways that you can connect with any of your peers. So that's just kind of one of the highlights for that. So any questions on engaging with those daily digest posts or how to find people in the directory, anything like that before I move on? Feel free to go ahead and unmute or chat in the chat box at all before I move on. All right. I'm going to go ahead and demonstrate for you now how you can access the platform from the CPCA website. So some people have opted out of daily digest settings, notifications, and I will show you guys how you can do that if you feel like a daily email is too much. We'll get into that here in just a few minutes. But say you accidentally unsubscribed and you need to access that platform. Well, Connected Communities, again, was created to support our peer networks originally. And so the first step from the CPCA homepage would be to click on this icon where it says Peer Networks, Task Force, and Work Groups. I don't know, can you see my mouse where I'm indicating, Peter? Do you see that? Someone, yeah, okay, good. I see heads nodding, thumbs up. Okay, so if you click on that icon, you'll see this first button says View CPCA's Peer Networks. You can click on that. And then this last button is to visit the Connected Community platform. I do want to highlight, because you can only see the communities for the peer networks that you are currently a member of. So if you're involved with behavioral health peer network, but you want to be part of, say, the HR peer network, you need to email training@cpca.org and ask them to add you to the HR peer network, and then you'll have access to that community as well. But let's go ahead. I'm going to click on this button here, and it's going to take me directly into the Connected Community site. So we do have a single sign-on experience for our members, and this was something that was super important to us. We wanted to make sure that you didn't have to remember another username, another password, and things like that. And so when you're logged into the CPCA website, it's that will bridge to the Connected Community platform, and you don't need to enter in another username and password. But if you're not logged in on the CPCA website, it will take you to the login screen. And then just a note on that, if you don't remember your username or password, you can email training@cpca.org, and we can reset that for you. And again, I'll include that in our wrap-up email after our session today. So let's see here. I want to go ahead and show you some benefits on how to get the most value out of this platform. So first of which would be this search bar that's in the upper right-hand corner of the platform. Say you have a question, but maybe someone else has already asked and that question has already been answered in the discussion boards. So you don't necessarily want to keep posting the same questions from different people. So my first suggestion to you would be to kind of search for your general topic, right? So say I need information about vaccinations. We've been doing a little bit with CDPH on vaccinations during COVID, right? And so what you'll see here is there's 41 different activity posts that all contain the word vaccinations within them. But you can filter this further. You could say, you know what, I remember Amanda posted something for everyone, and it was in the last month. So now you've narrowed it down to just one post. And so this might be the information that you're looking for. So that's, so I would strongly recommend that you first search for any topics related to what you're looking for. Obviously though, don't, you know, if it takes more than 3 minutes to find the information, please don't, you know, keep digging and keep digging. We don't want our members to be frustrated. We want this to be easy for you. If you don't see your question or answer right away, feel free to go ahead and post, and we will be moderating that. So no worries there. So when someone has posted something and has responded to it, so let me see if I can demonstrate this really quickly. So this is, you know, COVID federal and state updates. So Allie posted some Q&A guidance and Amanda's responded. If Allie had posted a question and Amanda answered that question, we could go in and we could say, make this the best answer. And by doing that, if someone comes upon this thread later and is searching for that answer, you'll see that it's noted. It's a different color. It's in green across the header, and it says this is the best answer. Now, sometimes the information might change. So if someone else has responded and they're saying, oh, wait, this is updated information, and this is now the best answer, you can mark that one the best answer, and you'll override the first one that we just did. So now Cynthia's post is the best answer in that conversation thread. And then lastly, what I want to, I'm going to clear that just because none of those were actual answers. And what I want to do is show, so if Allie had posted a question and several days have gone by and no one has responded, remember the Daily Digest email is going to only highlight activity that's happened in the last 24 hours. So what happens is Health Center staff are going to get one Daily Digest email that includes your question, but they're not going to keep getting it over and over until there's an answer. They just got it the one time. So if you go back to the discussion board, you'll see that we have a lot of questions that have been posted by Health Center staff. Like Fernando here, he posted a question 4 days ago and there's been no answer. What I would recommend to Fernando is to come back in here and reply to his own question and say, you know, I'm still looking for some assistance. Now, if he posts that, I'm not going to click it because I don't want it to show up in our Daily Digest. But if I were to click post, guess what? Now it's going to bring it back into the Daily Digest because there was activity in this conversation. And so Health Center staff might see that and be like, oh, yeah, let me get back to you on that. So I'm going to cancel out of there really quick. And then lastly, the last thing I really wanted to demonstrate, and then we'll definitely answer any questions that we still have, is your profile. So like most platforms and services that we use these days, you can access your account and profile settings in that upper right-hand corner. you click that little drop down arrow there and you can enter your profile. So in your profile, there's a lot of information. You can upload a headshot, but I do know some folks are a little more private. If you don't want a headshot, I strongly recommend that you maybe upload a picture of something that represents you, things you love. Maybe it's your Bitmoji avatar, something fun that people will associate with you. I do like to use headshots because we always remember someone's face, but we can never remember their name, right? And so this is the best way to help folks with networking. So you can edit your bio by clicking that little pencil there. Everyone's bio is blank. This is up to you if you want to set it up. You don't have to, but it is really nice to have that available. You can edit contact information that displays. So if you don't want it to display, you can definitely take some of these fields out. And then you can also link any of your social media accounts to your profile. So LinkedIn, Facebook, there's actually a lot more social media accounts than I'm even aware of. Also, these different tabs, you can go into here, you can see a list of all the communities you are currently a member of. Obviously, because I lead this program, I'm a member of every community. You can look at a summary of all of the activity that you have done in connected communities. But I think what folks want to see is some of the privacy settings and your notifications and email preferences. So really quick, I want to show this. If you are, say, working from home and you want your Daily Digest emails to go to your Gmail account and not the Health Center account, you can actually change that primary email address without actually changing your customer record. And so you can, that's what this top part is to change the primary email address only for the email notifications. And then down here is a list of each community, and you can customize the notifications you get for each community. So it's not just one notification setting for all. You would come in here and change it for each. So like if there's a COVID specific community and that information is super critical, you might want to change it to real-time notifications so that as soon as someone posts, you immediately get an email. If that's overwhelming, which it can be, then you can change it to the Daily Digest. And obviously you can turn off email notifications. We strongly recommend that you don't do this because, if it's out of sight, it's out of mind, right? You're not going to be like, oh, I need to log into Connected Communities and see what's happening. And so I do strongly recommend that you have some kind of notification email coming. But you'll also see these columns on the right side of this. You can have a consolidated Daily Digest. It's a little bit more condensed. And you can even turn on just a weekly digest that will summarize all the activity from the past week. So I could turn off that Daily Digest and just leave the weekly digest on for different communities. So that kind of covers everything I really wanted to share with everyone today. I know we're right at 12:30, but I want to give folks an opportunity. If you have questions or any comments, I'd be really curious if anyone has actually used this to ask questions or network with any of your health center peers. And yes, Gabby, I see your hand is raised. I think you can unmute your own line.
Hi.
There you go. Yeah.
I just didn't want to interrupt.
No, that's fine.
So my question is, if you're in a peer network, are you automatically like part of that discussion community, or do you have to like opt in or opt out?
Nope. You are automatically part of that community, and it's pretty much almost instant. So as soon as we add you into that committee, the peer network list, it probably might take about 5 minutes, a browser refresh, but as soon as you are added to a peer network, you will have instant access to that community. So if there's a community that you are not in, that you wish to be in, go ahead and email us. We can confirm which peer networks you're a member of already and maybe go over what other peer networks are available to you.
Perfect. Thank you.
You're welcome. Anyone else? I want to go ahead and make sure everyone gets an opportunity to ask their questions. I think one thing I do want to highlight, just because we have folks on our call or might be watching the recording that are not CPCA Health Center members, this is a CPCA member-only benefit. Currently, all of our peer networks and communities on the site are only for CPCA members. There may be future communities that will be open to all public, but those would be standalone communities. But our peer network, you know, all the work, conversation, and learning we do in our peer networks is a benefit only to CPCA Health Center members. So just an important note there. And lastly, if anyone hasn't logged into it yet or is having trouble logging in, please again email us at training@cpca.org. We can reset your login credentials. And then also lastly, I don't want to forget, Peter pointed this out to me and I want to make sure we highlight this. There is a mobile app that you can download to access all of the community conversations and have that information wherever you are. I know we're all over the place. There is a video that walks you through how to install that app. I'm going to email that to you all. It has a little bit of limited functionality. You can't include pictures or things like that, but you can definitely post your questions and find answers to information you might be seeking. So definitely encourage you to do that. I'm going to go ahead. I'm going to stay on for a couple more minutes, but we are right at 12:30. This was a 30-minute lunch and learn session. So if folks need to leave, please feel free to go ahead. We did record this session, so we'll send you a link to the recording so that you can share this with your peers and colleagues as well. And we'll be posting more information about it in Connected Communities. So again, thank you everyone for joining us today. I hope you found this session informational for you all.